Good morning and good afternoon, everyone. I would like to thank Zeiss for the kind invitation to talk about the benefits of technology evolution in my clinical practices. I have no conflict of interest or funding resource to be declared. I will focus my presentation on objective examination and diagnostic imaging. There were three main periods that marked my clinical practices by the emergence of different auxiliary means of diagnosis. Before 1997, between 1997-2017, and after 2017. Unlike today, the speed of appearance of the different observation and diagnostic device has been slowly emerging for 100 years. The first was the slit lamp at the end of the 19th century. The appearance of computerized static perimetry took about 100 years since the appearance of the Foster arch in 1869, as well as the development of the ophthalmoscope. Gonioscopy, since 1938, remains a milestone in the evaluation and diagnosis of patients. At the end of the 20th century, new imaging and measuring instruments began to emerge, revolutionizing the approach of glaucoma patients. It was in the early 19th that UBM appeared. Only 50 years later appeared in the market the first anterior OCTs. And my experience during this time was essentially with the SL OCT, allowing to identify iridium structures and alteration, even reto-iridian, as can you see in the last image, iridian cyst. Performs biometricals and angle measurements. Helps in the choice of the surgical strategy and helps in the post-treatment evaluation too, including refractive patients, as in this case. Angular evaluation in patient implanted with an artisan lens. Concerning the Cirrus HD OCT, the appearance of anterior segment lens can enable large amplitude scanners and not only analyze, but also quantify with a very good definition, like SLOCT, helps in the post-treatment evaluation too. Here you can see patients who, although have been submitted to iridotomy, iridocorneal contacts did not change. In the lower slide, you can see the opening of the angle after cataract surgery. In fact, he's become very useful in the assessing of the type of the iris, the relationship with the cornea and the anterior faces of the lens, being precious from the evaluation of surgical techniques and strategies. In conclusion, the evaluation of the anterior segment of the eye has become essential because it allows diagnostic and understanding physiopathogenic mechanism, help in the therapeutic decision and subsequent control, and is very important in pre- and post-surgical evaluation and information storage. In relation to the posterior segment of the eye, the appearance of the stereoscope photography and subsequent study have conditioned the technological development that has reached our days. The alteration found in the neuroretinal rims of glaucoma eyes and the description of isn't a rule were the basis of the development of the HRT and the study of the peripapillar RNFL alteration. The peripapillary atrophy, so well described by Just Jonas, was later identified in high-definition imaging of the OCT. This period between 1997 and 2017 was really a period of great development, and I will divide in two small periods. In the decade 1997-2007, I used the HRT. In the following decades, RRT3 and Cirrus HD OCT was my choice. The reason for this is that GDX does not allow to evaluate the optical disc, and the Stratus OCT was designed essentially for retinal pathology. I have the privilege of working with the first HRT and the following its evaluation. As well, I did some study with the Heidelberg fluorimeters. HRT allow optical disc analysis, neuroretinal rim thickness measurement, and even progression analysis. The study of the shape of the optic disc given possibility to establish a probability of the development of glaucoma. A normative basis, detection of change in the different parameters, and statistical evaluation was possible. But Cirrus HD OCT 4000 brings us a new era in the clinical evaluation and clinical studies. We all know the add value that brings us the different versions of Cirrus HD OCT. The possibility of progress analysis, both event and trend analysis, not only for the RNFL, but also for macular ganglion cells. My protocol for analyzing glaucoma patients involves radial HD macular acquisition over the macula and over the head of the optical nerve. As well, 21 HD APA lines over the macula. This approach allowed me to take a closer look at the cup analysis, peripapillar area analysis, lamina crinosa analysis, and helps also in OCT angio analysis. Here, the analysis of optical disc allowed the diagnosis of glaucoma with normal RNFL thickness. Allow to identify the different changes in peripapillary area, which has different cleaning means. And at the end, the arrival of angioplex opened again a new area, even without the model for the optical disc. The use of macular and optical has opened new ways to characterize the patients. Radial, peripapillar capillary, and visualization of perfusion area, choroidal slumps allow to identify the dropout zones and the prelaminar vessel density. Allow to compare analysis of vascular pattern either superficially or deeply. Integrate information as you see in this slide. Structural and vascular changing were detected and were congruent. This is another example integrate and congruent information, not only structural and superficial vascular abnormalities, but also in the deep slump and choroidal thickness. This is an example of a combination of information in the glaucoma of a young individual, the superficial pattern congruent with the loss of the RNFL and deeper perfusions changing. In this case, I show you the evaluation before and after glaucoma surgery. You can see the difference in the superficial pattern that are confirmed in later examination. The last year, you are treated to the specific model of the optical disc, giving us the possibility to quantify perfusion and flux in superficial plexus, but also analyze deeper planes in a customized way and integrate with other HD OCT information. It also gives us information on vascular density in pre-lamina cribosa. In conclusion, in my clinical practices, evaluation of slit lamp and gonioscopy are still fundamental for the study of patients. They are essential for diagnosis and follow-up, including in the operating room. Binocular fundoscopy is the basis for identifying all the details and assessing the color of optical disc and research of peripapillary hemorrhagia. The impact of phase 1 of ocular hypertensive treatment study made evaluation of corneal central thickness mandatory. Ultrasound pachymetry was the first method still in use. However, in case of the history of corneal refractive surgery or suspected keratoconus, the use of tomography and topography are essential. The high-definition anterior segment OCT can also be used. And as I mentioned already, gonioscopy is mandatory. Anterior segment OCT often guides the therapeutic strategy, and UBM is useful in some circumstances, like traumatism and tumor suspections, asymmetry between eyes, iris irregularities, and gonioscopy or anterior OCT suspicious. And finally, the regular evaluation in the posterior pole with OCT and OCT angio nowadays is indisputable. OCT angio is useful in focal defect of lamina cribosa, myopic eyes, peripapillar atrophy, progression with stable IOP, and perimetrical defects in central 10 degrees. And also when the eyes of the same individual have different behaviors. I hope that in short time, the development of the artificial intelligence methods in the glaucoma will allow us an integrate and complete evaluation. Only in this way, we'll be able to securely diagnose and follow up our patients at distance, so necessary in this new area. Thank you for your kind attention.